Did you know that around 17.5% of the adult population, roughly 1 in 6 worldwide, experience infertility? On today's episode, Liz and I chat with Amelia Hopkin about the fertility journey and how it can affect both women and men. We discuss common struggles and emotions, the role of family members and friends, and options for help, including EMDR and AR T, which can help people deal with traumatic experiences. Amelia Hopkin is a clinical social worker who has spent the last 23 years providing help and building relationships with medical providers, community organizations, researchers, educators, and most importantly, families who experience one of the hardest kinds of experiences: infant or pregnancy loss, infertility, unexpected birth experiences, various degrees and types of postpartum depression, NICU stays, as well as sexual or health-related trauma. She has been a speaker and trainer at both national and international conferences, a published researcher, is certified in EMDR and trained in ART. As one of the only trained EMDR intensive providers in the state of Utah, she helps those who have limited time and significant trauma find deep and meaningful healing. When not in the office, Amelia may be getting in over her head on a DIY project, reading books, dreaming up a new travel adventure, finding nature, looking for ways to avoid doing laundry, or trying out a new restaurant or recipe. We hope you enjoy the show.
Welcome to Stronger Marriage Connection. I'm clinical psychologist Dr. Liz Hale, along with my friend and colleague, Dr. Dave Schramm, professor at Utah State University. And together, we are dedicating our life's work to bringing you the best we have in valid marital research, along with a few tips and tools to help you create the marriage of your dreams. Well, Dave, it's so fun to hear from our listeners and viewers about the things that really matter to them. And today's topic is one of them, as you might remember. It's one of the hardest experiences to hit a couple longing to build a family of their own: infertility. Whether you or someone you love has experienced it, or an unexpected birth experience, or various degrees and types of postpartum depression, we have just the expert to provide insight and hope. Joining us today, it's licensed clinical social worker Amelia Hopkin. Welcome to Stronger Marriage Connection, Amelia.
Thank you, Liz. Thank you, Dave. It's good to be here.
Thank you for bringing us up to date on this crucial, heartfelt topic. Hopefully the numbers are going the right direction. I really have no idea. What's the prevalence rate of infertility today?
It's a good question, and as many good questions, not a super straightforward answer, but overall, it's interesting that across all socioeconomic status, across all parts of the world, it's around 15% of people experience infertility, either primary or secondary infertility. And although treatments are getting much better, because of the varying birth rates, it's really hard to tell, is it a birth rate drop or is it an infertility drop? But overall, that 1 in 6 is staying pretty steady.
1 in 6. Sounds just painful, doesn't it? Something that should naturally happen and happen easily is so difficult for many. Is it easier or harder to talk about these days, Amelia?
I think it depends on who you are, but overall, I think that culturally, we're really doing a great job of shifting the conversation from having infertility be this taboo subject that we don't talk about, don't bring it up, to something that's just a more healthy way to connect with other people. In some ways, it's because of education, specifically that it's not always the female or the mother in the relationship that is quote unquote the problem. And so it makes it easier to talk to moms about that. Also, there's so much more success happening than there used to be. Something like 70% of IVF is successful. So many reasons to be grateful and have hope. And yeah, you see so many successes out there. I think in some ways it's harder because everybody has a story. Everyone knows somebody that has, so many people know someone who has a infertility story. that they can kind of blow it off and say, you're going to a doctor, you'll be fine, don't worry about it. We're not going to, acknowledge that grief, and it can kind of feel undermining and dismissive. But also, I don't think the word infertility, people understand what that means as far as those treatments and the roller coaster of hormones and disappointments and hopes, the up and down. So at times it just depends on where they are in the process, if it's easier to talk about or not.
Well, that just brings up one quick question. Should I be calling it fertility treatments or infertility treatments? Is there a languaging?
Usually people like to focus on the positive.
Fertility
treatments, because we're working on achieving this.
Had a feeling.
Mm-hmm.
Had a feeling that was it. Thank you for correcting us. Great.
Yeah, Amelia, I'm curious about this as we talk about numbers a little bit. There's maybe different numbers for those who take a little while to get pregnant. I know for my wife and I, for example, it took us a little while. I ended up having to give her nightly shots actually for us because it just wasn't working. I know another couple who didn't have children, ended up adopting. Another good friends of ours in their early 40s who still have not had success. Very, very difficult. And another couple who's had 21 miscarriages. And so it just feels like that everyone's situations are different. What are some of the common struggles, knowing that there's a unique story and every situation is different? Are there some common struggles that come up for couples facing infertility and how it affects the couple relationship?
Yeah, it's catastrophic. Fertility issues can be catastrophic to any relationship, but especially the marital relationship, because underneath it all, there's usually this amount of grief, and everybody grieves differently, and everybody hopes differently, and every individual can be different about how much they're willing to hold on to hope and how much they protect themselves by kind of bracing against hope and kind of focusing on potential losses. And that synchronization really requires some high level communication to be going on in order to navigate those ups and those downs. So many of the answers to fertility issues are grounded in the medical field, where we place all of our hopes and dreams in the hands of a doctor, somebody that we don't know, in a lab coat, and they become the expert on whether we're going to be able to have a child or not, what that journey is going to look like. And all of a sudden we feel very much a huge loss of control. Turning that over becomes such a big deal. I don't want to say it ruins, but it does affect the difference between sex and intimacy. Because sex oftentimes becomes this chore. We need to do it at this time you've seen it on TV shows and movies. Oh my gosh, my temperature is blah, blah, blah. Let's hurry, and I need you home right now. So those types of things become a reality. And that's things that we may have mocked or laughed at in the past become your only hope. So there's that piece. But on top of that, if you are going to solve this, the fertility question, oftentimes with the medical model, they're going to try to find a reason why. And moms and dads will often mistake the reason why you're not being able to conceive as naturally and quickly as fault. It's mom's fault. It's dad's fault. And that carries an immense amount of guilt. And then on top of that, I'm dragging my partner, who I love very much, through this with me because my body can't do this, or because I fill in the blank. I've heard I didn't take vitamins when I was younger. I've heard I'm overweight. And so that's why I don't like exercise. And that's why I lived at a high altitude for a long time, right on into the spiritual realm of I misbehaved or didn't follow rules, or I did something atrocious when I was young. And this is God's way of punishing me. And it's also punishing. And then there's the financial impact. There's always a financial impact, whether that is, it's getting better. More insurance companies are covering fertility treatments, which is wonderful. But I can't tell you the number of people I know who switch jobs into a career they don't like, they don't want to be there, just because they can get insurance, because then it's going to be covered. And even if it is covered, you're still looking potentially $15,000, maybe even up to $70,000 out of pocket costs. It is such a financial drain. And let's talk about time. If you're going through treatments, it sounds like, Dave, you're familiar with, you plan your vacations around when you can get into your doctor, when you can travel, when company can't come on those dates because you're supposed to be, following doctor's orders that day, so you can't join them. It really can take over your life. People do not realize that commitment that comes along with fertility treatments.
Mm-hmm. Yeah. Wow. And that's just like the tip of the iceberg. I mean, this is such an important topic that I think affects so many people and how they feel. As you mentioned, again, a couple I know, I won't mention their names, and it's him who has, either low sperm count or the sperm that don't survive. And and he feels awful. He's like, I'm the problem, and I'm so sorry. And you may have not have married me if you would have known, all these things that go through that can really be painful. And this journey, as you mentioned, spills over, and it's the couple relationship for sure. And family, friends, support. We have nephews and nieces who have struggled with this, and we've all pitched in, and we've really tried to help them defray some of these costs because of what it can do to them financially and emotionally. So we've tried to rally around them as well. Tell us a little bit about the importance, kind of even the role, things maybe family members should or shouldn't say, families, friends, the support, without being too, intrusive. Where's that kind of that line? Do we never bring it up, and how do we bring it up?
Yeah, I think it, as all good therapists answer, it depends. So that doesn't give you any information. But one of the things that you kind of alluded to, Dave, just now is that it does become, not just a marriage and marital relationship, but relationship with family. Because if all of your siblings are getting pregnant and you're not, that makes it really difficult to go to Thanksgiving or to that baby shower or to go on that vacation or invite them over or spend time with them like you usually do. It can interrupt so many other relationships that the marriage relationship becomes even more important. And unfortunately, not all marriages, when entering into the fertility journey, are ready for that weight. So making sure that you are taking care of yourself as a couple and as an individual heading up to that is very important. But to your question, Dave, about what do people say? What is okay to say? It just depends on where they are in the journey. My rule of thumb is if they mention it to you personally, then they're okay with you asking some type of question. That's their opening the door, just a little crack for you to say, hey, how are things going with your family planning? How are things going with the fertility thing, the fertility treatments? Or were you able to get the money you were hoping for at that GoFundMe account? So that it's asking about them, not about the results.
Yeah. Okay.
Oh.
Yeah, that's great.
How are you doing? In other words, how are you doing? How are you feeling with this? Did I get that right? Is that what you're?
Yeah.
Okay.
Yeah.
Sometimes even I'll see a social media post or something as they share a little bit about their journey, their willingness. Then, Amelia, it sounds like if then often, we'll see comments and things because they need some of that support.
Yeah.
Okay. That's great.
Yeah. But if anybody if you ever open your mouth with starting the sentence with the words "at least," just zip your mouth.
Good advice.
After that, I spent 17 years working in a hospital, and when going into families who were going through some type of trauma or tragedy, I used to tell them, if someone comes up to you and says, at least you have another child, at least, you can get pregnant, at least you're young and you can keep trying, at least you have family support. my recommendation was just plug your ears, kick them in the shins, and walk away. But eventually the hospital said, I cannot be such a proponent of violence, so I have to quit. But I still feel like that's not a bad reaction.
Oh, gee.
So,
that is tough, isn't it? And yet the intent is hope, right? The intent behind someone who says at least, but thank you. I'm sure I have been guilty of it. I will really watch that at least. Do you mind, Amelia, setting up a scenario of steps for couples who are wanting to build their family? When should they begin to seek help? Like, when do you know, like, oh boy, it's been X amount of months or years? Where do they start and what can they expect, please?
Yeah, technically infertility, you can't qualify for an infertility diagnosis until after you have been engaging in unprotected sex for over a year. Now that's the diagnosis requirements. However, I usually recommend to families, as soon as you start to get really worried or you feel that something's wrong, listen to your gut and talk to your OB or talk to your family practice doctor. I have family members who started visiting and looking into fertility treatments maybe 4 months after they were married. And everyone, including me, thought they were just maybe a little bit hypersensitive. But as it turns out, there were so many medical things going on that had they delayed, they would have been putting off being able to grow their family for years and years. Because they were able to intervene quickly, that helped. So follow your gut. If you feel like now's the time, then now's the time. Start talking about that referral. And usually an OB or any medical provider aren't going to bring out the big guns. They're not going to refer you to IVF. And just a heads up, when you go in to talk to any doctor or provider about infertility, you might kind of think you're in the military because there are so many acronyms to learn and refer to. You're going to feel like it's medical lingo taken to another level. So it becomes even more confusing. So prepare yourself for that. Also, look and see what your insurance covers to see when you're having this discussion, what are you willing to do? How comfortable are you with moving ahead at what timeline? The doctors are going to start off with something really kind of low on invasive, like an oral medication that's going to help promote different ovulation or egg release. They're going to recommend that you eat healthy and exercise. I think it's like required of every doctor to say that at every visit.
I think so.
Even if you're a podiatrist, I'm sure they say
no matter what ails you. That's right.
Right. So they're going to recommend healthy lifestyle changes. And as silly as that sounds, a lot of them can do that. They're going to recommend that you reduce stress. And hopefully those lifestyle changes, in addition to some medication changes or additions, will be able to help with that pregnancy. But if not, then they will start referring you to a specialist. And the specialist will usually start with a whole bunch of blood work and sit down and talk with each couple about what their options are, as a result of what they're seeing on the blood work. It can be anywhere from what they call IUI, which is that intrauterine insemination, where the woman gets a shot all the time and she becomes a little bit on the hormonal side because that's what the shots is designed to do, is to change the hormones in her body to increase the chances of a pregnancy. I don't know any woman that says, please hop me up on hormones. That sounds like a good idea. So it's a hard thing, but everyone I've ever talked to thinks it's worth it if they get a baby out.
Wow.
So and then all the way up to IVF.
Touches my heart how much these couples going through IVF, whatever it is, for fertility treatments, how much they want a family. I'm just always just so touched and inspired by that they're willing to do some of these shots, whatever it takes. Something, isn't it? It's really quite inspiring to me. Yeah.
Even if it is something that's very private to them, you see so many of them become more open or willing to become more open with sharing it on social media with their family. And that just puts them in such a vulnerable place. So always, please be kind to people when they say that. Don't ever tell them, just relax, honey. It'll happen when it's supposed to happen. I can't think of a less helpful comment than just relax.
Yeah. Yeah. They need compassion. Yeah. Instead of advice or, yeah. You're a fan of support groups, Amelia. We imagine that couples supporting other couples is a sweet spot of refuge, really, and understanding. What else about support groups makes them so powerful? And this could be, I guess, online. This is in person or through technology, just being with other people that are experiencing similar situations.
Yeah, I think we are hardwired for connection. And anytime we go through something, whether it be infertility or loss or any type of a trauma, a diagnosis, anything, we start to feel like we're so much different than the community that we thought we were a part of. And it's no different with infertility. You thought you were just a regular old couple, and now you're pretty different. You feel very different. Those communities or those groups are the community builders. Those groups become your lifeline, whether it's because there are people there that understand what you're going through on a level others want to, but really can't understand because it's not there, or whether it's kind of the dark humor that you can share back and forth. Maybe not always dark, but just kind of barbed.
Inside humor. I understand exactly what you're saying.
That's a good term, inside humor. That inside humor is a tool that you can't use in a public setting, but the group setting you can. And you get to see so many different ways of people handling and coping with what's going on in their life that it becomes this beautiful tapestry of all these options of ways that you can handle it and not be wrong. Nobody likes to be wrong. Everybody likes to be as perfect as possible. And there is no perfect way to handle this. You get to handle it however you handle it, as long as you're not breaking laws.
We'll be right back after this brief message. And we're back. Well, let's dive right in.
What ways can a couple listening to us today, right here, who might be hurting yet hopeful, navigate that fine line, Amelia, between disappointment and hope?
I recently came out that Inside Out 2. And in that movie, they have, for those of you that haven't seen it, there's a scene where all of the emotions are gathering around kind of this core personality of the girl that they're all a part of. And she's in trouble and they all want to help her. So they all circle around her beliefs about herself and they just hug it. And that is maybe one of the best visual illustrations I've seen in a long time of what it's like to go through this type of a loss. It's okay to hope, and it's okay to be pessimistic. It's okay to be happy because you have some answers, and it's okay to be disappointed that you're not pregnant. Becoming comfortable with these complicated, contrasting emotions side by side at the same time is a really important skill to be able to develop. And it will get you through so many different scenarios during this roller coaster ride of infertility and many others. But just knowing that if you could change it, you would. And no one is blaming you for what you're going through. And if you saw someone else going through this, you would be so much more compassionate and kind and understanding. So please give yourself that compassion, that understanding, or that grace. Just go easy on yourself. Blaming yourself does not help you achieve your goal. It really is a waste of energy and time. And most of the time, it's not even true.
Yeah, thank you. This is great counsel, great guidance. Amelia, I'm curious about men, in this this journey that you talk about, this infertility journey that many maybe in society maybe don't realize, or maybe they're kind of behind the scenes that this is a woman's journey. Tell us about the role of men and sometimes what they're experiencing, going through.
Okay, thank you. To my eternal shame, I have spent far too many years not paying attention to the dads in these situations. I thought I was doing a good job because when I would go in the hospital and talk to the dads and say, we know that this is so difficult for you with this loss or this news, and we want you to know that you're part of this journey. This is your loss as well. And then we turn back to mom and, talk to her. And even in that brief little shining moment where the spotlight hit dad for 30 seconds or less, I would see dads nod their head and either get stone-faced because they're not supposed to have emotion, or they would just break down and sob. And I would see moms their wives grab their hand and pat them and say, thank you, because dads just do not get the acknowledgement. Since then, we've tried to up our game. And there are quite a few studies now that talk about not just in the infertility world, but just reproductive health in general. A woman usually starts experiencing postpartum depression in the third trimester of the pregnancy. Then the earlier it starts, the more likely those symptoms will escalate and become difficult. And that's not just mom experiencing those. It's the partner as well. Significant issues. They did a study that they asked all these moms, were you depressed during the pregnancy? Were you depressed after the pregnancy? And they got kind of higher than they expected. So they asked dads, how many of you were depressed post-pregnancy? And almost 0%, none of the dads said that they had a named depression. Well, that's pretty impressive since that's far below the national average of men in general. So according to the results, men were getting happier after delivery. No, nobody gets happier on no sleep. So they went back and they said, okay, men, here are the depressive symptoms. Check the boxes, the ones you experienced. The data came back and has been repeated all through several studies. 1 in 10 men suffer from postpartum depression. That number jumps to 1 in 2 or 50% if their wife or their partner experiences any type of postpartum mood disorder. I don't know any woman who goes through infertility or fertility treatments and doesn't experience depression. So by those, I don't know how men don't experience it. So they are so much the forgotten. They're men, by culture or by genetics, however you like to see it, are the fixers, the providers, the protectors. And here's a situation they cannot protect their loved one from. Here's something that they cannot fix without a doctor telling them what to do, how to do it, when to do it. And maybe the doctor says, I can't help you. And they cannot make their wife feel good about that because they don't feel good about that. And even if there can be something to be done, if there even is something to be done, then he has to go work 3 more jobs in order to make the money to pay for the treatments or for the vacation because you need a break and you need to get away from it all. The weight is so heavy and it's been so under-recognized from the beginning. My heart goes out to dads.
Thank you. That's very well said. Yeah, I think men will appreciate you saying that, recognizing, validating that.
Is it accurate to say that the infertility journey comes not only with grief and disappointment, but even with, let's say, trauma?
Yes,
yeah.
Absolutely. Trauma, there's several definitions out there, but anything that doesn't really, I don't want to use the word jive, but I can't think of another one right now. but doesn't connect with the expectations you have. There's, disappointment level. But when it really starts restructuring all your relationships, the way you spend your time, your career goals, your relationship with your body, yeah, the way you trust yourself, the way you see yourself, oh yeah, that's trauma every time.
And with regard to that trauma that you're talking about, I believe you're one of only a few trained EMDR intensive providers in Utah. Will you explain a little bit more about EMDR, eye movement desensitization and reprocessing, right? Can you walk us through a little bit about what that is and why it's helpful?
Mm-hmm. You bet. It is a mouthful. Eye movement desensitization and reprocessing. I think they named it that just to make themselves kind of feel better about being smart sometimes.
Right.
And I got to be honest, the first time, I tell everyone this, the first time I had a colleague mention EMDR to me, I just said, I thought you were smarter than to believe in this voodoo crap.
Yeah. Isn't that funny?
What in the world? Where are you going with this? And the more I heard about it, the more I became convinced that even if you think it's voodoo crap, it works. There is something to it. So I've had clients call it Harry Potter therapy. I've had some of them call it magic. I don't believe it's magic. It's very rooted in neuroscience. But as to what it is, the idea is that any traumatic event is, I see it, this is going to date me. I visualize it as, in the libraries back when maybe some people were growing up, they had the little card index that you would look it up, get the card, and then go find the book instead of just click and order it from Amazon. If every one of those cards are an experience or a memory or a sensation or a interaction or a belief about yourself. When there's not trauma, it just goes into our brains and files in line, and we can go and recall it when we need to. If there's trauma connected to that, whether it be through a sensation, a feeling, a belief of self, whether it's just a single event or ongoing, those cards tend to not like to stay there, and they keep popping out and disrupting your life. So what EMDR does is it takes those cards that are popping out, that are not allowing you to function well, and finds the common thread through all of them, and you follow it back. But you do it using eye movement. So whether you are, the therapist kind of does this back and forth. And if you're a Prince Harry fan, he talks a lot about it. That's what he did. So going back and forth using your eye movement, what they believe happens is it activates both sides of your brain so that you can sense it and think about it both at the same time, and use your whole brain to work through that rather than just the parts of your brain that are activated through talk therapy. And in doing that, when you pull that thread out, realize what it is and resolve it, all of those cards just end up going back into the place they're supposed to stay. You can access them, but the incredibly strong, overwhelming, impulsive feelings are no longer associated. So it kind of unhitches the emotion piece from the memories of the event.
Okay. Yeah, that is very helpful. Thank you.
I don't know if you saw Prince Harry, Dave, on Good Morning America, I think it was. And he actually showed a clip of his therapy session with his therapist. I believe is online. She might have been in London. She sounded like that beautiful accent. He was in America. And he talked about just the trauma of London and the loss of his mother, and how much better he is through EMDR therapies. I just think that was wonderful. So bold of him to share with the world.
I love it when people, especially people with influence, are willing to be vulnerable about the real things.
Mm-hmm. And it makes sense that would be traumatic. Gosh, we didn't really maybe think as much for these boys, or maybe we did at the time, but we've kind of forgotten what they've gone through.
Mm-hmm. And that's natural because everybody else's life moves on. And similar with infertility, everybody else's life moves on, but you're still back here in this infertility world, fertility struggle world. And it becomes this forgotten, this disenfranchised loss where everybody else moves on and thinks that you should too. And then thinks of it as not that much of a loss. Oh, I've heard people say it's kind of like losing a pet. It's not that big of a deal. You just kind of move on. Or I'm like, are you kidding me? Or they say, well, how could you love a baby you've never met, that you've never had? I don't know about men because I've never been one, but I know girls, and a lot of girls start their relationship with their future children when they're 7, 8, 9 years old, rocking their baby, dreaming about being that mom, and it becomes part of their identity. So the trauma involved.
Naming those babies, right? I had all my names selected at that early age, right? Well, the names of my children, who they would be. Yeah. So
Did you use any of the names?
You know what? I didn't have a chance to have a family. I married a little bit later in life. Amelia, married at 50. So we have lots of nieces and nephews. So I get some of that, just a little bit, never having gone through fertility treatment. I kind of get a little bit of that pain. Oh, I understand.
Yeah, Liz, I'm with you. I felt like talk about imposter syndrome because I don't have a family either. And so working with these families who were experiencing infant loss or infertility, I was like, you guys, I'm just giving you information here. But it was my clients and my patients that helped me see that although loss does not equal loss and it's not the same, that loss of a family and loss of dreams is the common thread that everyone, regardless of your situation, can relate to.
Can all relate to some level, right? Of some area.
Yeah.
That's really well said. Is there, Dave and I were wondering, is there a client success that stands out to you that described how I need to say it better, how EMDR eliminated a distressing event? Does some client in particular come to mind, Amelia?
Oh, so many. Yeah. I am thinking of one in particular who came in with some significant postpartum depression, almost postpartum psychosis issues. Wow. And her comments were, my husband said, I can't have another baby until you fix me. I was like, wow. P.S. It doesn't say emotional mechanic on my door. So, I don't know. But let's give this a shot. And we used EMDR and realizing that sexual trauma from youth was a component of her birth trauma, and looking at how things went down in the hospital and after the hospital and her false core beliefs that she had about herself. And doing all of that, not only was she able to, when she became pregnant, she handled it beautifully. And although very, very nervous to go and deliver again, this was several years ago, got a text that said, I made it through and I didn't even cry. I made it through and I didn't dissociate. I made it through and I remember every moment. It was beautiful.
That is something. How thrilling.
Wow. In addition to EMDR, we've heard a little bit about ART or ART, this accelerated resolution therapy. How is that different or similar to EMDR?
Great question that a lot of people have. And people who are really diehard EMDR fans and clinicians may not agree with me. So I'm just putting that out there. This is personal. Sure. But having been trained in both, EMDR came first, and then a clinician in Florida started doing a version of EMDR and found that for her it worked amazing. EMDR is incredible, and renamed it ART and has been doing it ever since. EMDR is very client driven, very non-directive. We just kind of see where your brain goes and what connections by trusting the brain to make those connections and those realizations. It works really well with single event trauma, but it also works really well with attachment issues from youth, or some people pre-verbal. I'm not trained in pre-verbal, but with ART is much less self-directed. It's very like, we're going to do this and you're going to do this. And then now picture this. And then it's very regimented. Now it can be as flexible as you need it to be, but you follow a very strict protocol and voila, you tell them what to do. And they do experience a significant amount of relief. I think, yeah, some of it is the skill of the clinician. Which one, but that's the biggest difference, I think, between the two. One is very client directed. One is very clinician directed. And one, EMDR can last multiple sessions. Ideally, ART, once you've gotten that case conceptualization done, is one session, like a one and done. Where I do EMDR intensives, we do oftentimes, not with every one of my clients, we do extended EMDR sessions, 2 hours, 3 hours, or sometimes we do 4 or 5 days of solid EMDR, but we get 8 to 10 months of therapy done in just a few days. You can do the same with ART. I just haven't seen the research data saying how effective it is long-term. It just hasn't been around long enough to have that longitudinal data.
My goodness. No wonder you love EMDR. I mean, that's really impressive. And I'm anxious to hear more about ART. I think that's really quite exciting too. You know, when someone comes in to see you, Amelia, how do you decide which direction to take? Someone it's, you know, they have a history based in trauma and it's dysregulating their behavior today. Where do you decide as an expert to go EMDR or ART?
Oftentimes people are coming in now with a request. They come to me to EMDR or they come to me to do ART. And so we client directed, right? We let them do it. If it's more attachment based or they're going to continue to be exposed to that trigger or that person, then I usually go EMDR. And that's primarily because that's what I'm most comfortable with those protocols. But if they come in with a birth trauma, a one-time event, then ART works beautifully to be able to take care of this one occurrence that's still sticking in their head, a car accident, some type of a sexual assault, maybe like finding out about a divorce or infidelity. Those types of things ART can work really well for. Really quickly.
It's amazing. When you said birth trauma, at first I was thinking back to hypnotherapy. Are you talking about the person's birth trauma? No.
Although some people do that, I do birth traumas as in the mom who is experiencing trauma surrounding birth.
Fascinating. Yeah. Okay. Wow. All kinds of interesting things.
Yeah, Amelia, this has been awesome. So eye-opening, really, and very helpful. I'm sure our listeners are many of them can relate to this, or have a sister or a friend or someone who is experiencing this fertility journey. So thank you so much. Before we let you go, we like to ask our guests a couple of questions. One, the first one, staying true to the name of our podcast, Stronger Marriage Connection. What do you feel like is the key to a stronger marriage connection?
I don't think there is just one key, but I don't think you can have that strong connection without compassionate communication. I think that is got to be there. Yeah, absolutely. Yeah, one of my favorite words in the English language, is compassion. Love that. Yes. And a second question is we call it our takeaway of the day. What's your take-home message that you hope our listeners will remember from our discussion today? That if you're experiencing fertility struggles, you are not alone. Again, that number is 1 in 6. There are some really fantastic resources here in the state of Utah. There is it's called the Wellness Farm down in the Bluffdale area, run by Amelia Hopkin. And she does retreats and groups using animals and sound baths and lots of stuff like that. There's also, they used to be called the Infertility Resource Center in Salt Lake. And I want to say they just went national, but they provide free advice and free resources to anyone. And they have it divided up beautifully. Like if you're in the beginning, if you're considering your options, if you're doing IUI treatments, if you're looking at adoption, if you're like all of it, if you're looking at ways to fundraise, they do conferences. That is a place to start to identify your tribe. That's a fantastic place to go to find those resources. And then the other one is Postpartum Support International. PSI is a great organization as well. And they do online support groups for a lot of different things related to reproductive health. But they do have an free infertility group that you can hop on. I think it's twice a month and participate or just listen. So the takeaway I want people to have is please don't think you're alone in this, because you're not. There are places you can go to be understood, to find your tribe.
Yeah, well said. And we'll be sure to put those resources in our show notes as well. Liz, what about you? What's your takeaway of the day with our
I love the thought of getting comfortable being uncomfortable, right? With whatever it is that is troubling us, that isn't going the way it should. And this whole concept of 1 in 10 men faces, is it postpartum depression just by themselves, but 1 in 2 if their wives is facing postpartum depression. Did I get that right?
Yeah, exactly.
So men.
Maternal postpartum depression.
I can only imagine. I'm so glad we have that data. It's so important to remember those good husbands, right? Who are right along with that journey with their wives. I think so highly of these couples. Dave, what nugget do you want our listeners and viewers to remember most about our interview today with Amelia Hopkin?
Yeah, it's been super, Amelia. I think my takeaway of the day really is the no shame, the no blaming of yourself through this journey. I'm sure it's so easily to turn inward and then to have those suffocating feelings that can feel overwhelming, that affect your marriage and your outlook, your life, your eating, sleeping, everything. This will affect your life in so many ways. I hope people won't go there or stay there too long. You realize this is nothing you did, anything. So avoid that blame and shame game. Keep those eyes up and looking for resources and help. So
that is so good. Speaking of resources, where can our listeners and viewers go to find out more about you and your practice? I think you've created a practice with other talented therapists. Did we get that right?
Yeah, thank you. Yeah, we do. I collected some of the best people I've met over the last 22 years in this field. And we are located in South Ogden, but we do virtual. It's called Growing the Good Counseling Services. And the website is growing-the-good.com.
Beautiful. Well named. And people can find out about being in groups if they want, right? Finding other couples. What other support groups do you offer, Amelia? I'm curious.
We offer usually in the month of October a infant loss group for those who have lost pregnancies and infants, stillborn or NICU babies. Right now, we are having a parent group. It's called Space, and it's supportive parenting for parents of anxious children. So if your child is showing OCD or some type of compulsive, anxious behaviors, how do we train the parents to deal with that in a way that doesn't divide the couple, but keeps them together and reduces the anxiety in the child so that parents get to be the expert on their own child, sending the child to therapy for it.
Hooray. That's wonderful.
That's great. Well, thank you again, Amelia, for spending your hour with us and, sharing your expertise on these tender topics, from infertility to trauma to healing to so many resources. It's been very helpful for us and for our listeners today. So thanks again for joining us.
Dave, Liz, thank you for having me. Yeah. Thank you for helping families.
It's been an honor.
All right. Yep. Friends, we'll see you next time.
And remember, it's the small things that create a stronger marriage connection. Take good care now.
Thanks for joining us today. Hey, do us a favor and take a second to subscribe to our podcast and the Utah Marriage Commission YouTube channel at Utah Marriage Commission, where you can watch this and every episode of the show. Be sure to smash the like button, leave a comment, and share this episode with a friend. You can also follow and interact with us on Instagram at Stronger Marriage Life and Facebook at Stronger Marriage. So be sure to share with us which topics you loved or which guests we should have on the show next. If you want even more resources to improve your marriage or relationship connection, visit strongermarriage.org, where you'll find free workshops, e-courses, in-depth webinars, relationship surveys, and more. Each episode of Stronger Marriage Connection is hosted and sponsored by the Utah Marriage Commission at Utah State University. And finally, a big thanks to our producer, Rex Polanis, and the team at Utah State University, and you, our audience. You make this show possible. The opinions, findings, conclusions, and recommendations expressed in this podcast do not necessarily reflect the views of the Utah Marriage Commission.